Welcome to Move or Improve with Debbie. I'm Debbie Miller, your host for the day, and I'm going to talk a little bit off topic today. Usually we talk about some sort of housing or retirement issues, but I want to have a session on Medicare and Medicare Advantage. And we have so much information to include that we're going to do it in two segments. So make sure you listen to this show and then the one next week as well. You may already have a plan in place, or maybe you're looking at your options. Either way, you're going to learn insider tips from Brad Rothermel and Randy Phillip. Together, they have over 50 years of insurance experience, and they're going to talk with me today about choosing the best Medicare or Medicare Advantage plan. And as I said, it's going to be a two-part program because we're jam-packed with stuff to say. So stay tuned for this week and next week. So welcome to the show, Brad and Randy.
Thank you.
So let's get started. What is Medicare exactly? Describe that in as simple terms as possible.
Sure. That is, Medicare covers your hospital and your doctor charges for people over age 65 or people that have been disabled on Social Security for 24 months.
Interesting. So what is Medigap then?
Okay, good question. All right, so with original Medicare, you get your Part A and your Part B, so that covers your hospital and your doctor charges. You also are required to purchase a prescription drug plan, okay? And what Medigap is, because original Medicare only pays for 80% of your medical, your doctor and your physician charges, your doctor and your hospital charges, that 20% difference is paid for by the actual person. So a Medigap policy puts a gap on that. It covers the gaps that original Medicare doesn't pay, so that your 20% that you're liable for is not unlimited.
Okay, so Medigap is the same as Medicare Advantage, or are they separate?
They're separate. So there's original Medicare, Part A and Part B. There's Medicare Advantage plans. That's where you have original Medicare, Part A and Part B. And then you sign up with an insurance carrier so that when you go see the doctors, you use your insurance carrier card instead of your original Medicare card. And then there's the Medigap or Medicare supplement, and that's for people who say, I'm not going to go with a Medicare Advantage plan. I'm going to stay on original Medicare and just buy a supplement to help supplement the things that the original Medicare doesn't pay for.
Okay, so, and you said that anybody, the disabled within the past several months, and then people over 65. So can somebody be turned down for Medicare other than for age?
No, you cannot. So to meet the requirements, you either have to be over age 65 and be eligible for Part A and Part B Medicare, okay? Or if you're under age 65, you have to be disabled by Social Security for 24 months, and then that will make you eligible. You cannot be turned down for Medicare under any circumstances. So there's no medical conditions, there's no age. Once you make those original qualifications, you're eligible for Medicare.
Okay, that's good. So how does somebody know, what they need? We can't foretell the future. And how do you make changes to your policy if you need to?
Okay, well, a couple of things. You would look at what doctors do you like to go to, or you need to go to. So, for example, I've got clients that say, I've been seeing this doctor since I was X years old, and this doctor knows me and knows all of my conditions, and I want to make sure that I still have the ability to see that doctor. So we would look at which insurance plans has that doctor within the network. We would then look at what is the premium, what is the monthly premium. We would look at what are the co-pays, okay? So what are the co-pays per service? We'd look at what the maximum out of pocket is. So worst case scenario, there's always a maximum out of pocket, the most that you'll have to pay. Worst case scenario, we would look at that. And then we'd look at the drug formulary that each particular carrier has, just to make sure that your doctors are in the network, that the payments that you would have to pay are reasonable, and that the prescriptions that you need to have filled are covered within that carrier's drug plan.
So what if you have an emergency, like you have to have like knee replacement, or you have something that switches you to a long-term care kind of operation? What happens with your plans in that situation? Do they keep
Well,
going, or do you have to change them and modify them, or how does
no,
that work?
no, you don't have to modify them for that, but you are able to modify your plans every open enrollment, which we're coming up to now. So the open enrollment period is October 10th through December 7th, and that's when people are able to reassess their plans and decide that they're going to make a plan change starting January 1.
Okay, that sounds good. Yeah. So you just sign up before you turn 65, or do you have to wait until you're 65 and then come up on the government site and do it that way? Or how do you actually physically do it? I know a lot of people 10,000 seniors, baby boomers turn 65 every day. So there's going to be a lot of people doing this.
Sure. Yeah, great question, Debbie. So in terms of signing up for Medicare, folks would typically do that either through their local Social Security office or on Medicare.gov. And so there is a initial sign-up period for Part A and or Part B during the 7-month period that begins 3 months before the month in which you turn 65, includes that month, your birthday month, and then ends 3 months after the month where you had turned 65.
Oh, okay. So as long as they know their age, they're okay. Okay. So,
Correct. Now there can be an exception to that.
okay.
If you have a, which is common these days, obviously a lot of seniors still in the workforce. So if you're still actively at work and covered by a group plan, there are situations where you can delay enrollment in Part B until you come off of that group plan, and you would not suffer any kind of a late enrollment penalty.
Do you have to alert Social Security before, if that's the case, or they won't penalize you if you wait until you're actually off of that plan and onto the one that they provide?
Yeah, so typically the beneficiary would get their letter from Social Security saying your Part A is effective this date, and if you want Part B, here's what you need to do. And so they would contact Social Security and say, well, I'm not enrolling in Part B because I'm still covered by my employer.
Okay. All right. Well, then let's go back to the different parts, because I know it can sound confusing to somebody who's not really familiar with it, but the A, B, C, D, and they don't have to recite the whole alphabet, but those parts are the ones that they will have to address. So talk a little bit. And what doesn't it cover? That's another important thing.
Okay, so yes, it can sound like it's alphabet soup, but like you say, we can kind of stop early in the alphabet at least. So Part A is the inpatient hospital coverage. Part B are outpatient benefits. Both of those items are also known as original Medicare, and that's what's provided by Social Security. Part C is what Randy had mentioned previously, a Medicare Advantage plan. And then Part D is prescription drug coverage. And so these latter two, Part C and Part D, are both provided by private insurance carriers. And in terms of things that are not covered by A and B, include things like long-term care, most dental care, routine physicals, eye exams related to prescribing glasses, and hearing aids are some kind of key things that are not covered by original Medicare.
Okay, but there is dental care provided through a separate policy that the person has to pay on their own, and also vision, I think, too.
Correct. So those two items are typically some extras that are built in to a Medicare Advantage plan, or if someone is on a original Medicare, maybe with a Medigap, then yes, they could also purchase standalone dental and or vision care.
Oh, that's okay. So just clarify, if somebody has original Medicare, why would they need more coverage? What would be the reason for doing that?
Sure, I'll take that one. Yeah, so remember, original Medicare is going to cover 80% of your charges. And that other 20% of the charges are going to be borne by the individual. And so that 20% is unlimited. So, you think about cancer treatments, or you think about any advanced treatments, or if you're just having a bad year where you're seeing a lot of doctors and hospitals, that 20% is unlimited. So that's where people will buy that Medigap or that Medicare supplement plan, which fills in the gaps that original Medicare does not cover.
Interesting. So what happens, I'm just trying to think of different scenarios now, so pardon me while I digress, but what if the doctor that you love leaves the network that you've enrolled in? Can you change plans midstream or not?
No, traditionally they don't let you do that. There would have to be a major network loss, a major hospital system loss mid-year, something that reduces the network adequacy. That's something that Medicare sets up to say, are there enough doctors in each individual specialty within X amount a radius drive? But just one doctor leaving is not going to open up a special election period for you to change. So you would have to wait until the open enrollment period, which again starts next month.
Oh, yeah, that's true. It's coming up. So talk a little bit about how original Medicare and Medicare Advantage, which is Part C, how are they different? So that people could figure out, what do they want to choose?
Okay, certainly. So there are some key differences. I'd say the primary one would be the use of a network. So if you're enrolling in a Medicare Advantage plan, those use a provider network. Most services on those plans then are only covered in network aside from emergencies. However, there are some Medicare Advantage plans that are a PPO or preferred provider option, which allow coverage both in and outside the network, albeit with higher out-of-pockets if they're out of the network. The Part C plans, though, anything under that Medicare Advantage umbrella, they are required to cover everything that's covered by original Medicare, but then they can also provide some of these additional benefits we've mentioned, like dental and vision. Transportation is a benefit that's unique to a Medicare Advantage plan, where if a senior needs rides to a doctor, some transportation is often built into these plans, and fitness memberships as well. Those are quite popular.
Okay, that sounds good. But okay, so say that somebody signs up for a given year and they want to switch plans. They don't like the way things are working out. How do they do that? Do they have to wait for the enrollment period?
Well, that's a great question. So typically they can enroll or make changes to a Medicare Advantage or standalone prescription plan during the annual enrollment period, October 15 to December 7th, with the new plans effective January 1. However, for your scenario, if somebody is already a member in a Medicare Advantage plan and whatever things blow up in January, they are really dissatisfied with the service or there's some major issue, there is what's called the Medicare Advantage open enrollment period during the first quarter of the year. So from January 1 to March 31, someone who's currently in a Medicare Advantage plan can make a change to another one.
Interesting. Okay, but that's the only time that you can do it. So, okay. So you better really research through you guys, actually, to make sure you're making the right decision on what plan works best for you. So now, if somebody has a plan that includes some dental and some vision with it, do they still need a standalone plan